Onchocerciasis. Onchocerciasis, also known as a river blindness and Robles disease, is a parasitic disease caused by infection by Onchocerca volvulus, a nematode roundworm. Onchocerciasis is the world's second leading infectious cause of blindness. The parasite is transmitted to humans through the bite of a black fly of the genus Simulium. The World Health Organization estimates that 37 million people are infected with Onchocerca volvulus worldwide. Of these people, 270,000 are blind and 500,000 have some sort of visual impairment. Some 90 million people are at risk for becoming infected with the parasite. The vast majority of infections occur in sub-Saharan Africa, although cases have also been reported in Yemen and isolated areas of Central and South America. Disease caused by infection by Onchocerca volvulus. During a blood meal, an infected black fly introduces third-stage filarial larvae onto the skin of the human host, where they penetrate into the bite wound. In subcutaneous tissues, the larvae develop into adult filaria, which commonly reside in nodules in subcutaneous connective tissues. Adults can live in the nodules for approximately 15 years. In the subcutaneous nodules, the female worms are capable of producing microfilaria for approximately 9 years. The microfilaria have a lifespan that may reach 2 years. They are occasionally found in peripheral blood, urine, and sputum, but are typically found in the skin and in the lymphatics of connective tissues. A black fly ingests the microfilaria during a blood meal. After ingesting the microfilaria migrate from the black fly's midgut through the hemicoil to the thoracic muscles. There are microfilaria develop into first-stage larvae and subsequently into third-stage infective larvae. The third-stage infective larvae migrate to the black fly's proboscis and can infect another human when the fly takes a blood meal. Skin involvement typically consists of intense itching, swelling, and inflammation. A grading system has been developed to categorize the degree of skin involvement. Acute papular onchodermatitis, scattered pruritic papules. Chronic papular onchodermatitis, larger papules resulting in hyperpigmentation. Lichen-feet onchodermatitis, hyperpigmented papules and plaques with edema. Lymphadenopathy, pruritus, and common secondary bacterial infections. Skin atrophy, loss of elasticity, the skin resembles tissue paper, lizard-skinned appearance, and depigmentation, leopard-skinned appearance, usually on anterior lower leg. Ocular involvement provides the common name associated with onchocerciasis, river blindness, and may involve any part of the eye from conjunctiva and cornea to uvea and posterior segment, including the retina and optic nerve. The microfilaria migrate to the surface of the cornea. Punctuate keratitis occurs in the infected area. This clears up as the inflammation subsides. However, if the infection is chronic, sclerosing keratitis can occur, making the affected area become opaque. Over time, the entire cornea may become opaque, thus leading to blindness. Diagnosis. The most common method of diagnosis is a skin snip. A 1 to 2 milligram shaving or biopsy of the skin is done to identify larvae, which emerge from the skin when it is put in physiologic solutions. Polymerase chain reaction of the skin can allow for diagnosis if the larvae are not visualized. In patients with nodules in the skin, the nodule can be surgically removed and examined for adult worms. Infection in the eye can be diagnosed with a slit lamp examination of the anterior part of the eye where the larva or the lesions they cause are visible. Antibody tests have been developed to test for infection. Treatment. People who are found to be infected with Onchocerca volvulus should be treated in order to prevent the long-term skin damage or blindness. The recommended treatment is ivermectin, which will need to be given every 6 months for the lifespan of the adult worms or for as long as the infected person has evidence of skin or eye infections. Ivermectin kills the larvae and prevents them from causing damage, but it does not kill the adults. Prevention. There are no vaccines or medication available to prevent becoming infected with Onchocerca volvulus. The best prevention efforts include personal protection measures against biting insects. This includes wearing insect repellent and exposed skin, wearing long sleeves and long pants during the day when black flies bite, and wearing permethrin-treated clothing. Looiosis. Loa filariasis, also known as Calabar swellings, is a skin and eye disease caused by the nematode worm Loa. Humans contract this disease through the bite of a deer fly or mango fly, the vectors for Loa. The adult Loa filarial worm migrates throughout the subcutaneous tissues of humans, occasionally crossing into subconjunctival tissues where it can be easily observed. Loa does not normally affect one's vision but can be painful when moving about the eyeball or across the bridge of the nose. The disease can cause red, itchy swellings below the skin called Calabar swelling. It is estimated that 12–13 million humans are infected with the Loa larva. Human looiosis geographical distribution is restricted to the rainforest and swamp forest areas of West Africa, being especially common in Cameroon and on the Ogooué River. Disease caused by the nematode worm Loa. The vector for Loa filariasis are flies from 2 hematophagous species of the genus Chrysops. During a blood meal, an infected fly introduces third-stage filarial larvae onto the skin of the human host, where they penetrate into the bite wound. The larvae develop into adults that commonly reside in subcutaneous tissue. Adults produce microfilariae which are shaded and have diurnal periodicity. Microfilariae have been recovered from spinal fluids, urine, and sputum. During the day they are found in peripheral blood, but during the non-circulation phase they are found in the lungs. The fly ingests microfilariae during a blood meal. After ingestion, the microfilariae lose their shells and migrate from the fly's midguts through the hemicoil to the thoracic muscles of the arthropod. There, the microfilariae develop into first stage larva and subsequently into third stage infective larva. The third stage infective larva migrate to the fly's proboscis and can infect another human when the fly takes a blood meal. Filariasis such as loasis most often consist of asymptomatic microfilariemia. Some patients develop lymphatic dysfunction causing lymphedema. Episodic angioedema calabar swellings in the arms and legs caused by immune reactions are common. When chronic, they can form cyst-like enlargements of the connective tissue around the shears of muscles, tendons, becoming very painful when moved. The swellings may last for 1-3 days and may be accompanied by localized urticaria, skin eruptions, and pruritus, itching. Subconjunctival migration of an adult worm to the eyes can also occur frequently, and this is the reason Lo is also called the African eyeworm. The passage over the eyeball can be sensed, but it usually takes less than 15 minutes. Cancer incidence of eyeworms have approximately the same frequency, but it tends to increase with age. Eosinophilia is often prominent in filarial infections. Dead worms may cause chronic abscesses, which may lead to the formation of granulomatous reaction and fibrosis. Diagnosis: the identification of the adult worm by a microbiologist after its removal from under the skin or eye. Identification of an adult worm in the eye by a healthcare provider in a patient with risk factors for infection. Identification of the larva on a blood smear made from blood taken from patient between 10 a.m. and 2 p.m. Identification of antibody against LO. Treatment: the disease is treated with the drug diethylcarbamazine, and when appropriate, surgical methods may be employed to remove adult worms from the conjunctiva. Prevention and control: there are no vaccines available to prevent becoming infected with LO. Diethylcarbamazine, taken once a week, is effective at preventing loosis in long-term travels to affected areas. As the D flies breed in muddy, shaded areas along rivers and are attracted to smoke from wood fires, avoiding those areas may reduce one's risk of infection. Other prevention efforts include personal protection measures against biting insects. This includes wearing insect repellent on exposed skin, wearing long sleeves and long pants during the day when the flies bite, and wearing permethrin-treated clothing. Dracunculosis. Dracunculosis, also called guinea worm disease, is a parasitic infection caused by Dracunculus medinensis. Once prevalent in 20 nations in Asia and Africa, the disease remains endemic in Africa. Dracunculosis is caused by nematode roundworm Dracunculus medinensis. Humans become infected by drinking unfiltered water containing copepods, small crustaceans, which are infected with larvae of Dracunculus medinensis. Following ingestion, the copepods die and release the larvae, which penetrate the host stomach and intestinal wall and enter the abdominal cavity and retroperitoneal space. After maturation into adults and copulation, the male worms die and the females migrate in the subcutaneous tissue towards the skin surface. Approximately 1 year after infection, the female worm induces a blister on the skin, generally on the distal lower extremity, which ruptures. When this lesion comes into contact with water, a content that the patient seeks to relieve the local discomfort, the female worm emerges and releases larvae. The larvae are ingested by a copepod and after 2 weeks and 2 months have developed into infective larvae. Intestine of copepods closes the cycle. As the worm moves downwards, usually to the lower leg, through the subcutaneous tissue, it leads to intense pain localized to its path of travel. The painful burning sensation experienced by infected people has led to the disease being called the fiery serpent. Other symptoms include fever, nausea, and vomiting. The worm can survive in subcutaneous tissue for years. Treatment. The traditional method of removing it by winding it laboriously round a stick, withdrawing it gradually a little more each day, is still an effective way to get rid of worms, although surgical removal is also an option. Prevention and control. Surveillance and case containment, provision of safe drinking water, vector control using a chemical larvicide, health education and community mobilization.